A CPAP machine, continuous positive airway pressure, is a piece of equipment that aids in the treatment of sleep apnea, also known as obstructive sleep apnea. The CPAP machine is specifically designed to keep the airway open at night to allow a normal breathing pattern. How does it do this? The CPAP machine has three elements: the machine itself, the pipe or tube, and the mask. The machine is set to a certain pressure by a sleep physician. This pressure pushes air through the tube and mask and into the user's airways. The air forces the airway open to ensure they remain clear and wide during sleep so the user can maintain a normal oxygen level and functioning respiratory system. This combats the issue caused by obstructive sleep apnea. Obstructive sleep apnea. People who have OSA experience periods of non-breathing during sleep. This occurs when the airways collapse or become relaxed, meaning no air can get to or from the lungs. A common symptom of OSA is snoring. This is because the airway is not wide enough for air to pass through quietly. Snoring is often accompanied by choking or gasping sounds and moments of no breath at all. Whilst it would appear snoring is harmless, sleep apnea not only causes sleep disturbance but can have a more drastic outcome should an individual stop breathing for a prolonged period of time during sleep. This is why it is essential that OSA is treated correctly. How to get treatment. If you suspect you or a loved one has OSA, you will need to use a CPAP machine. They are designed specifically for this reason. Typically, your first call will be to your GP. It may be useful to take a loved one with you, as they may experience more of your symptoms than you do and therefore be able to explain them better. Your GP will then refer you for a sleep study. However, you can skip the GP phase and book a private sleep study yourself. During your sleep study, you'll be monitored and checked for the signs of OSA and other sleep disorders. Sleep physicians will then assess your results and assign you an individualised treatment plan based upon the severity of the issue. Your dedicated sleep physician will then work with you to ensure you have the correct CPAP machine to suit your needs. It is possible you will also have to make some lifestyle changes, such as losing weight, changing sleep position, changing diet, and exercising more. You may also be asked to keep a sleep diary and track your moods. Sleep apnea is known for causing a lack of rest, which usually presents as mood changes in the sufferer. Do you have to use a CPAP machine? Your treatment plan is dependent upon your diagnosis, and this is something your sleep physician will talk through with you. However, if you have a sleep apnea diagnosis, it is likely you will be advised to use a CPAP machine. Some alternative treatments that you could be offered depending upon the severity include tonsil removal, weight loss guidance, and gum shields. Conclusion: who should use a CPAP machine? Anyone suffering from sleep apnea is likely to be offered a CPAP machine as treatment. They are designed specifically for OSA sufferers and literally save lives one breath at a time.